What OTs do best. Hi, I'm Louise Fouché from OTGrow and welcome to our YouTube channel. Here we discuss tools, tips, and techniques to make you an effective group facilitator. And today we are unpacking the concept of what OTs do best. So, out of conversations around the history of occupational therapy in South Africa last year, we put together a feedback that stipulated all the different topics that was discussed on those two panel discussions, inviting really our veteran occupational therapists, those in clinical practice today, and also anybody that had an interest in it. And one of the things that came up, and I would actually like to read it to you, we wrote in the article, there was a decision on the need for OTs to have a strong emphasis on OTs' unique contribution to group work, especially incorporating activities. An interesting shift seems to be away from psychoeducation groups, with some of the practice giving the psychoeducation over to other MDT members so that they can focus on what OTs do best, which is activities, tasks, and occupation. And maybe today I'd like you to ponder a little bit on the groups that you present to your clients. A lot of occupational therapists are taking on ACT or acceptance and commitment therapy. They're taking on cognitive behavioral therapy. They're taking on dialectic behavior therapy. They're taking on mindfulness, neurosync, and a lot of these techniques that are not OT specific. And I have a slight worry that at the end of the day, any counselor can replace an occupational therapist to do DBT, and sometimes even at a cheaper rate. And I think it's important for us to pause a bit and really consider what is the unique contribution that occupational therapists can make, especially in terms of groups. And so the interactive group model, which is a model I heartily support, is able to address a lot of the things that make occupational therapy so unique and have unique contribution that other team members are not able to step in and facilitate. So I'd like to leave you with a couple of thoughts. So the interactive group therapy, or maybe you have another occupational therapy a model for groups. And I think the point here is not necessarily the one model above the other, but it's thinking about how do I make a unique contribution to the mental health care user that somebody else in the MDT team cannot. So the one thing is to understand that one of our unique contributions, as the article also said, has to do with the fact that we address occupation. And a lot of times, yes, DBT, CBT, ACT, mindfulness are all techniques that can be used and content presented within occupational therapy groups. But it doesn't really address a unique contribution of occupational therapy. So, where is the occupation performance area that is being directly addressed with your occupational therapy group? In the interactive group model, we directly address social participation. It doesn't matter what group we present, we're always mindful of the fact that we are addressing social participation, that we don't talk about social participation, but we do social participation. That in this group, you are through the doing, indirectly and directly, you are improving your social skills. You are improving building healthy interpersonal communication. That in this group, social participation is directly being addressed because of the interactive nature that appears in any of the groups. All groups that are designed in the interactive group model has the specific unique contribution that it's not about just teaching, but it's about the doing and ensuring that our clients improve their social participation. The second element is that we walk in with a goal. I do realize a lot of the other techniques or approaches also have goals attached to them. But I think it's important to understand as occupational therapists, we move into a group space with a specific goal. We don't just wait for a process to unfold or see what happens, but we have a specific goal. The second or third thing that occupational therapists have a unique contribution is the tasks, activities, and occupations that occur within the group space. And I think here a lot of the other methods fall short. There isn't a specific activity. Might be an application of a technique, or there might be an application of something specific learned. But the actual use of a task and an activity in which we use our very special skill of activity analysis and bringing that to meet the goal, that by the time the people have completed the activity or the task, they have met the goal set out for that activity, and that there isn't too much more unpacking or trying to incorporate more elements or more discussions. Once the activity is finished, the goal is reached, we have addressed an OPA, and that is one of the things that I think makes the interactive group model so strong. Again, I'm not saying that's the only one OTs can use, but I think we have to be very careful and rethink, are we using occupational therapy specific groups? Are we bringing what we do best as occupational therapists in the group space? Are we leaning into our profession? Are we really proud of what our profession has to offer? And just as a way of introspection and closing off today, maybe the question to ask is, what makes occupational therapists grab all these alternative techniques that are not OT specific? Is it that we don't have the evidence for our occupational therapy groups? Then maybe that is what we need to address. Is it that we shy away from activities, that there's still something ingrained in us that makes us ashamed of that? Then that is what needs to be addressed. Because from the to keep ourselves relevant as a profession, we need to make sure that we are presenting what OTs do best, what makes OT's contribution unique in an MDT team. Maybe in this coming week, you can ponder that and take a step back and have a look. Are you doing what OTs do best in your group practice? Until the next episode, happy facilitation.